Midostaurin, also known as Rydapt, is a medication used to treat specific types of blood cell cancer, such as acute myeloid leukemia, AML, and mast cell leukemia, MCL, as well as an immune system disorder called mastocytosis. It works by slowing down or halting the growth of cancer cells and certain immune system cells known as mast cells. It is important to take Rydapt exactly as prescribed by your doctor and to follow their instructions for the best results. The typical daily dosage and the optimal timing for taking Rydapt will be determined by your doctor based on your individual medical condition. Before you start taking Rydapt, make sure to read the patient information leaflet given by your pharmacist. Take this medication by mouth with food as directed by your doctor, usually twice daily, every 12 hours. Swallow the capsules whole and do not open or crush them. The dosage will depend on your medical condition and response to treatment. Some people may not need to take this medication every day, so follow your doctor's instructions carefully. Your doctor may also prescribe other medications to prevent nausea and vomiting, which you should take as directed. If you vomit after taking a dose, do not take another dose at that time. Use this medication regularly at the same times each day to get the most benefit. Do not increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and will increase your risk of serious side effects. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe. Grapefruit can increase the chance of side effects with this medicine. Some common side effects of Rydapt include nausea, vomiting, diarrhea, stomach or abdominal pain, mouth sores, constipation, hemorrhoids, headache, dizziness, tiredness, muscle or joint pain, and trouble sleeping. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits to you outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as increased thirst or urination, signs of kidney problems, signs of infection, easy bruising or bleeding, unusual tiredness, vomit that is bloody or looks like coffee grounds, or black or tarry stool. Seek medical help right away if you experience symptoms of lung problems, fast or irregular heartbeat, severe dizziness, or fainting. Although very rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. If you experience any side effects, you can report them to the FDA in the US or to Health Canada in Canada. Before taking Rydapt, it's important to let your doctor know if you're allergic to it or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist for more details. Before using Rydapt, make sure to inform your doctor or pharmacist about your medical history, especially if you have lung or breathing problems. Rydapt may cause a condition that affects the heart rhythm, known as QT prolongation. This can rarely cause serious fast or irregular heartbeat, as well as other symptoms such as severe dizziness or fainting that require immediate medical attention. The risk of QT prolongation may be increased if you have certain medical conditions or if you are taking other drugs that may cause QT prolongation. It's important to inform your doctor or pharmacist about all the drugs you are taking and if you have certain heart problems or a family history of certain heart problems. Low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation. This risk may be heightened if you use certain drugs or have conditions such as severe sweating, diarrhea, or vomiting. It's important to talk to your doctor about using Rydapt safely. Rydapt may cause dizziness and using alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing activities that require alertness until you can do so safely. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Rydapt, especially QT prolongation. If you are pregnant or planning to become pregnant, it's important to let your doctor know. You should not become pregnant while using Rydapt, as it may harm an unborn baby. Both men and women using this medication should inquire about reliable forms of birth control during treatment and for 4 months after the last dose. If you or your partner becomes pregnant, it's important to talk to your doctor right away about the risks and benefits of this medication. It is unknown if Rydapt passes into breast milk, so it is not recommended to breastfeed while using this drug and for 4 months after stopping this drug. It's important to consult your doctor before breastfeeding. When taking Rydapt, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. It's also important to note that other medications can impact the removal of midostaurin, the active ingredient in Rydapt, from your body, which may influence how Rydapt works. Examples of such medications include rifamycins, like rifabutin, St. John's wort, drugs used to treat seizures, such as carbamazepine, phenytoin, and others. Be sure to discuss any potential interactions with your healthcare provider. If someone has taken too much Rydapt and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or the local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center. It's crucial to act quickly in these situations to ensure the person's safety. It is important not to share Rydapt with others. Your doctor may also require you to undergo lab and/or medical tests, such as liver function tests, complete blood count, and blood mineral level tests, while you are taking Rydapt. It is important to attend all medical and lab appointments as scheduled. Be sure to consult your doctor for more details. If you forget to take a dose of Rydapt, just skip the missed dose and take your next dose at the usual time. Don't take double the dose to make up for the missed one. Rydapt should be stored in the original package at room temperature, away from light and moisture. It's important not to store it in the bathroom, and to keep all medications out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.